Hello, welcome. I'm Dr. Tony Magliocco, and this is a new episode of the Cancer Informant. Today, I'd like to talk about the GI ASCO 2023. This is an interesting meeting I try to attend whenever I can. The meeting actually did not happen for the last few years because of the COVID situation, but 2023 was the start of the in-person GI ASCO meeting. It's usually held in January in San Francisco. And it's a great meeting where experts from around the world come together to discuss advances in colorectal cancer and GI cancers. I found the meeting useful from a diagnostic and precision medicine point of view, and I thought I'd share some of my thoughts on the meeting this year. So there are a few areas that struck me as being interesting in the meeting. The first is the use of molecular profiling. That it's becoming more clear now that many cancers have different molecular subtypes and are being driven by different molecular pathways. There's been numerous developments of targeted therapy that are created to block these specific pathways. Now, while the incidence of a specific mutation can be rare, if it is actually uncovered, the response to a treatment can actually be dramatic. And if there are a lot of different targets, if you do an analysis, then they start adding up and there become many treatment opportunities for a patient. One of the most important messages that came through was the importance of molecular profiling of the tumor, particularly certain tumors such as cholangiocarcinoma, where several actionable mutations are now known. Examples of these include things such as IDH1 mutation, amplification of FGFR, fibroblast growth factor receptors, and also particularly fusions, NTRK 123 fusions. Now, from a molecular analysis point of view, these are not trivial to uncover. Because fusions are challenging. The best way to uncover them is actually using RNA analysis. For copy number variation, you need to have a lot of genes to be able to measure if a particular gene has a copy number change or amplification. And then there is also importance in new protein measurements as well, for example, in HER2 and so on. One of the takeaway messages was that a molecular profile is probably indicated in most cases of GI cancers, particularly to uncover these pan-tumor treatable effects, which means that NTRK fusions can actually occur in any cancer, and you're not going to find them unless you do a proper molecular analysis to uncover them. Now, even though they're rare, if you do happen to get one, the response tends to be dramatic, and by dramatic, a patient may go into remission for many years, even if they have an advanced disease. So it's important to uncover these, and the message is also important there that the assay or the test that is used needs to be of sufficient depth and quality to be able to pick these mutations up. For these fusions, that means often looking at a good RNA assay, and there actually aren't many of these. So having a high quality assay is important when evaluating these tumors. So that was quite interesting to see. Like I said, not just cholangiocarcinoma, but other GI tumors as well. So that was one finding that was important. Another finding that is interesting is the role of HER2, which is known to be very important in breast cancer. And there's some recent advances in breast cancer over the last year where HER2 treatments have been extended to not just cancers that have high levels of HER2, but also cancers that have low levels of HER2 may also respond to targeted treatments where antibodies are used, and there's antibody conjugates. So this is where an anti-HER2 antibody is loaded up with another drug, and the antibody delivers that drug to the tumor. Now, it appears that HER2 is also involved in colorectal cancers and GI cancers, including esophagus cancers, gastric cancers, and colon cancer. So there's a great deal of advancement being made in terms of targeting HER2. So that was an important advance, and also raises the situation where HER2 does need to be actually tested now in these tumors to make sure that a patient has that treatment option available for them. So that's certainly important. Another area where there's significant discussion was liquid biopsies. So liquid biopsies are becoming more prominent, and there is significant discussion as to whether they're ready for prime time. Now, it appears that liquid biopsies are very valuable, particularly the ones that can uncover actionable mutations. Now, when evaluating liquid biopsies, some of them only tell you whether or not tumor is present, and I think these have limited value, and the discussion on them is how they're best used for minimal residual disease, et cetera. But in a liquid biopsy that can actually pick up an actionable mutation, for example, the fusions, can be of particular value in selecting treatments and targeted therapies. Use of liquid biopsies is certainly gaining more attention, and I think greater acceptance, so that liquid biopsies will be more utilized in the clinic. Remember, liquid biopsy has different readouts. One of them is the circulating tumor cells, and that can give you information about whether there's actual cancer cells in the blood and whether those cancer cells have expression of protein on them, for example, HER2 or PD-L1. This can be quite important in selecting a therapy for a patient with advanced disease. But also the cell-free DNA is important as well, as to whether there's actionable mutations, including things like copy number increase in FGFR or HER2 or others. And the RNA can also be measured to determine if there are actionable fusions, like the ANTRAC fusions that we talked about before. These new tests can really help an oncologist select approved treatments for a patient, and also assemble opportunities for a trial for a patient to get onto certain clinical trials using targeted agents. I was also intrigued to hear that there's also a lot of interest in terms of combining now immune therapies with targeted agents. For example, combining anti-HER2 with checkpoint inhibitors may dramatically cause a synergistic effect. So I think we're going to see more of those opportunities as well in the future, where there are combination of therapies given. And again, this leads to the question, or also the concern, that proper testing does need to be done so that tumors are correctly classified, and also that the molecular targets are properly uncovered. Also, there was increased interest in the role of genetic testing, that it turns out that maybe many patients with colonic cancer and other GI cancers may actually have an inherited condition where they've inherited a mutation of one of the DNA repair enzymes. And if a patient does actually have one of these inherited conditions, that it's important to uncover that, because, again, there are particular therapeutic strategies that can be used to treat patients with particular tumors that have these genetic drivers. For example, microsatellite instability, which is a feature of Lynch syndrome, or homologous recombination deficiency, that's seen in conditions such as inherited breast ovarian cancer syndrome or BRCA1 mutations. So that was quite intriguing as well. So in summary, I think it's, again, an exciting time for GI cancers, in that there are many trials that are now underway, and many of them are producing positive results, which are exciting. And many of the results are actually quite impressive. Particularly some of the targeted agents against some of the fusions which are being identified, and also some really dramatic responses for tumors that have microsatellite instability. So it's now advised that most tumors be tested for microsatellite instability, and that these tumors may respond so well to immune therapy that they can almost be put into complete remission and may not even need chemotherapy. So there are a lot of advances quickly being made in the area of cancer treatment. So in summary, always have an accurate pathology diagnosis. So make sure that the tumor is properly classified and staged. But even more so now, getting a proper molecular profile is very important for selection of targeted agents and also appropriate immune therapy when indicated. Liquid biopsies are becoming more useful in terms of measuring response to treatment, but also looking at tumor evolution and perhaps changing treatment over time as a tumor potentially develops resistance or changes to express different proteins or different alterations that may now be susceptible to alternative treatments. And then lots of exciting areas looking at genetics, where genetics may play a role in the genesis of these tumors, in their behavior, and also the response to therapy. So thank you for tuning in today and listening to my updates from GI ASCO, coming from beautiful San Francisco this year. And please visit our website to hear other episodes of the Cancer Informant, and also to leave comments and questions that we can address in future episodes. So thank you again for listening. I'm Dr. Tony Magliocco. I'm the Cancer Informant. Have a wonderful day. Bye-bye.